So in the last two parts, we saw the diagnostic radiology, and today we'll be talking about the therapeutic radiology, where the radiology is used to cure something. So the radiation oncology, which mainly includes the treatment of cancer, it is of two types. One is external beam radiation, where the radiations are given from outside body, and it is of, depending upon the source, we is from X-ray photon, electron beams, neutron beam, and proton beam. While the brachytherapy is the internal radiation therapy, where the source is put it inside the body, and through that the radiations are uh, given out. Now the treatment mainly include the consultation, then the clinical treatment planning, simulation, medical radiation physics, dosimetry, and clinical treatment management. So the clinical treatment planning in the radiation oncology is basically the process of creating the customized plan to deliver the radiation therapy to the patient's tumor. Uh, and the aim is to maximize the tumor cell killing and minimize the damage to the surrounding healthy tissue. And if you see, the codes are simple, intermediate, and complex, and the codes divided depending upon the number of the treatment area and then the blocks which are used. So basically the simple could be when the cancer is not spread anywhere and it is in the single area, and the blocks require is lesser. So let me just clarify what is this port and what is this block. So the port is the specific area of the body targeted for the radiation delivery. So wherever the cancer is, that specific area is basically the treatment port. And the radiation oncology blocks are nothing but the shielding block, which are made up of the special material. They protect the healthy tissue and organ near that tumor from unnecessary radiation exposure. And if you see, the intermediate is two separate treatment area, that this could be the case of the metastasize, where there is a primary area and then the secondary spread also. And the complex could be when the spread is lot more. I mean, rather than one area, the spread has gone to 2 3 areas. So this is what all about treatment plan. Then comes the simulation. Radiation oncology simulation is the crucial preparatory step before starting the radiation therapy. It involves creating a personalized plan for delivering radiation to the target area of the body. Again, here also, if you will see that the codes are divided depending upon the simple, intermediate, and complex, and the language remains pretty much same whether you are treating the single area, two separate area, or three or more treatment area, because that will decide whether it is a simple, intermediate, and complex. And you will see the three codes here. So these are the diagrammatic presentation of the simulation, where you prepare the patient for the radiation treatment that the patient will be taking. So sometime we have to do the marking on the patient's body. We have to give a particular face shielding material, or sometime we have to give the pillow to the patient to raise a particular body part. So you prepare that positioning of the patient for the radiation, and then when next time the patient comes, the patient will lie in that position, and where the exact he has to align with that exact marking, and then the radiation start. So simulation is basically creating the exact environment prior to that actual radiation. So this is what the simulation looks like. So the next part is a dosimetry. Dosimetry refers to the science by which the radiation dose is determined by the measurement and calculation. See, the dosimetry is basically the how much doses to give, and that varies from patient to patient, whether it's a male or female patient, what is the weight of the patient, what is the height of the patient, what is the age of the patient, and depending upon that we change it. And for that also you have this simple, intermediate, and complex code. So more or less you will see that for dosimetry, simulation, and clinical treatment planning, we pretty much use the code grouping as a simple, intermediate, and complex. Now let us understand the radiation treatment management. The codes, CPT codes, are primarily 77427 and 431. So if you see the code 77427, it mainly talks about the 5 radiation treatment typically over the course of 1 week. While the 431, this is the code we use it whenever there is only 1 or 2 fraction of the treatment has been performed. Now these two codes 77427 and 431, these codes are inherently the professional component of the service, so therefore there is no need to append a modified 26. This is very important because sometime it will help you to eliminate the wrong option, because if they put a modified 26 on any one of this code, you can immediately eliminate that option. And the code 427 and 431 should not be reported together for the same course of treatment or the time period. This is also one important guideline. This will also help you to eliminate wrong options. Now let us understand the guideline for reporting 77427. The CPT code 77427 should be reported only once for the first 5 treatment session, because that is the code language, that for first 5 treatment session we write 77427. Now additional reporting. So for the treatment session which is beyond 5, so the additional unit of 77427, because we will have to add additional unit of 77427, then in that case the mantra is you should add that additional unit only when there are 3 or more than 3 additional treatment units. So for example, when we have given 5 treatments to the patient, I'll write only 77427 one time. If it is 6 to 7 treatment, still I will write only 1 unit. Why? Because 6 means 5 plus 1, 7 means 5 plus 2. And what is my mantra? 3 or more than 3. Now, if the treatment is 8 or 10 treatment, dosage or the unit, then we are going to write 77427 multiplied by 2, because 8 means 5 plus 3. 9 means 5 plus 4 and 10 means 5 plus 5. So that time we will require 2 units. Remember that. I hope you understand this. Let us take one example to make your concept more better. A patient with a colon cancer receives a several radiation treatment. 7 radiation treatment. During the course of the treatment, the physician views the port film, reviews the treatment parameter and assesses the patient response to the treatment. Code for the radiation treatment management. And we have this code. Now how many? 7 radiation treatment. Okay. So how will I do it? 5 plus 2. Do I need to add additional unit of 77427? Definitely not. Because what is the mantra? 3 or more than 3. So we will write the answer 77427. Now if this question comes in your exam, without going to your book, you can eliminate option D, because this is a guideline that we cannot code these two code together. And even this is not the way one write the code, because this is not the correct way of writing the code. So in between A and C, we need to decide. Okay, and just check this, and it is like table of 5. Okay, the simple way, and additional unit is 3 or more than 3. Now take the same example, but instead of 7 radiation, we are counting the 13 radiation. Okay. So what is the unit of 77427 I'll require? I will require 3 unit. Why? 13 is 5 plus 5 plus 3. Right? So for the first 5, okay, first 5, I will require 1 unit. Then for the second 5, I will require 1 unit, and the third is 3 because it is 13, and when it is 3 or more than 3, I will have to add 1 more unit. So my answer will be 77427 into 3. So let us take one question that has come in the exam. A patient with a colon cancer receives a 9 radiation treatment. During the course of the treatment, the physician views the port film, reviews the treatment parameter and assesses the patient response to the treatment. Code for the radiation treatment management. Now, I showed you how to do the calculation. Do the calculation and tell me the answer. So yes, 77427 into 2 is the right answer, because 9 radiation means 5 plus 4. For the first 5, I will write 77427. and the second is additional 4, and for that I will have to add a unit of 77427 because the mantra is 3 or more than 3. Okay, so that's the correct answer. So this is a quick catch up of all the codes or the steps that we have seen as far as the radiation oncology is concerned. We talked about the therapy planning, simulation, and then the radiation management. And remember, all these are the professional component of the service. So these codes are the global service code. So we don't put a TC as well as the modified 26 on this code. Now let us look at the radiation treatment delivery. These are mainly the technical component codes only, and if you see, these are the code which are there in the radiation treatment delivery. And if you see the code language, they also talks about the simple, intermediate, and complex, more than 1 MeV, the radiation dosages, and the code differs depending upon the number of the areas and then the port and the blocks. And all the treatment delivery codes are reported once per treatment session. The treatment delivery code recognizes the technical only service and contain no physician work. So this is very important. While the previous thing what we saw was the only professional component. So let us take some question to strengthen our guideline. A physician manages the radiation therapy treatment for the patient with a small cell lung cancer who's receiving 18 MV external beam application with one port and two blocks. Which CPT code is reported for the radiation therapy services? So this is the radiation therapy services. We have the codes below, and what is important for us is that all these code they were divided depending upon how many ports and how many blocks. So here there is one port and two blocks. So I'll be looking for that language in the code to zero down my code. So 401 is the radiation treatment delivery superficial and ortho voltage per day. 402 radiation treatment delivery 1 MeV simple. Now what is a simple means? It is a simple is one port and two block. Intermediate is two port and multiple blocks or more than three blocks, something like that. And 412 is a complex. Complex is basically whenever there are more than three port. Port is the area of the treatment. And 77385, it is basically the intensive modulated radiation treatment, which is called as a IMRT, and this is definitely not that. So in between these three, A, B, and D, and we have eliminated even B because it is a complex in between A and B. Tell me the answer. So yes, 77402 is the correct answer because it talks for the simple treatment, and we know one port and two blocks. Now let us look at the proton beam treatment. It is a type of radiation therapy which uses a proton beam to target and destroy the cancer cell. It is also categorized into simple, intermediate, and complex, and the guideline remains the same. There also we mainly calculate the treatment ports and then the blocking shield. The only difference between the proton beam and the conventional radiation therapy, that this therapy delivers the high dose of the radiation to the tumor while minimizing the damage to the surrounding healthy tissue. So if you see this structure, the proton beam stops here and it only destroys the tumor, while here the conventional beam passes through the tumor and it may affect the normal cell structure. Now, this is a favorite question that has been asked repeatedly under the CPT guidelines section. So, how is the proton beam treatment delivery defined? Now, many a time, how to approach the answer for this question. So, what you will do is you will pick up what has been done here, the proton beam treatment. So, I'll pick up that and I'll go to my index and I'll look for the word proton treatment delivery, and here it is written complex, intermediate, simple. What you can do is here you get the answer many a time, but you can pick up this the code and go directly to that particular section. There also you will get the answer, so you pretty much know what's the answer. So yes, B is the correct answer. Now the next is we are looking at brachytherapy. It is a form of internal radiation therapy where what we do is there is a radioactive source which is in the form of capsule or tablet which is placed directly inside or near the tumor, allowing the high dose of radiation to be delivered locally while minimizing the exposure to the surrounding health tissue. So, for example, if this is the the breast tumor case, and if we are giving the brachytherapy, we put those the capsule or the seeds around that the breast, and it will start dissolving and giving the radiation, and that's how the radiation therapy is given. Now, as far as the brachytherapy is concerned, we have the intracavity and interstitial. This is just for your knowledge that intracavity means where the radioactive sources are placed within the body cavity. That's why it is called as the intracavity. So commonly used for the gynecological cancer like cervical and endometrial, where we put the seed or that material into the bodily cavity. And interstitial means where the radioactive material is implanted directly into the tissue. So for example, if the patient is having prostate cancer, we directly put that seed into the prostate or into the breast. So this is the interstitial. Okay. So that's the only difference. Why I'm giving you, because these are the words which you will see in the code language. So for brachytherapy also we have the code language of simple, intermediate and complex, and where we talk about the source or the ribbon. So if you can see, these are the seeds or the source which are put inside the prostate gland, and this is a ribbon where you can see there are seeds inside. So depending whether you are giving one or four sources or the ribbon, that will decide your code. Now, let us take the question on brachytherapy. Jim is received two fraction of high doses electronic brachytherapy at a freestanding oncology center. What code report this service? And we have this option. So let us look at all the options. 77799, it is a unlisted procedure, clinical brachytherapy. 0394T into 2. Now this code looks slightly different, and if you remember, this is the code which is for the evolving new therapies in the field of medicine. And so the next year you will get a permanent code for this, but this must be the latest new electronic brachytherapy. We have this code, and high dose rate electronic brachytherapy skin surface application per fraction. So this is the code for that. And 77761, it is the code for intracavity radiation source application. Now, and this code is there, 4 times 7 and 8. Now if you look at this particular code, below that there is a code, sorry, parenthetical note that do not report this code along with this code, because I can see this code here. So A is definitely not the option. Even 61, this 77761 is not the option, because this is for the intracavity radiation source application, and what we have done is electronic brachytherapy we have done for the patient. So after going through this, tell me what's the correct answer. So yes, C is the correct answer, and we will go multiplied by 2 because the code talks about per fraction. Now, why we cannot write the unlisted procedure? Because in the CPT there is a general guideline that if you have the very specific code, we will pick up that code. Since we have the specific code, maybe it's a new code and temporary code which will become a permanent, we will pick up that code over the unlisted procedure. Now the last section in this is the nuclear medicine. Nuclear medicine is a specialized area of the medical imaging and therapy that uses a small amount of radioactive material to diagnose, manage or treat the disease. So as far as the nuclear medicine is concerned, we use it for the diagnostic as well as treating, that is the therapeutic. Okay, remember that. So, as far as the diagnosis is concerned, we have the PET scanner, gamma scanner, which is called as the SPECT scanner. So that is the diagnostic, approach where we are trying to check everything. And as far as the diagnostic nuclear medicine is concerned, it is divided into endocrine, hemopoietic, and lymphatic, gastrointestinal, musculoskeletal, cardiovascular, respiratory, nervous, and genitourinary. And in the therapeutic, you will see that the nuclear medicine can be used to, to treat the cancer, radiation treatment, neuroendocrine tumors, prostate cancer. The modified 26 is used when billing the professional component only, for example, interpretation of the PET scan, where the interpretation is done by the doctor, so we will require a modified 26. So these are certain example of the code where the nuclear medicine is used for the diagnostic purpose, where we want to find out the thyroid uptake, myocardial perfusion scan, lung ventilation, renal scan, and the radio pharmaceutical or the therapeutic use is basically used for the intravenous administration, for the oral and subcutaneous non-intravenous route, and then intracavity radioisotopes therapy. So this is where we use the nuclear medicine for the therapeutic purposes. So let us look at this question. A patient had a myocardial perfusion imaging single study at rest with quantification, ejection fraction, and wall motion studies. The procedure was performed in the nuclear medicine department of the hospital. How would you report the professional service for the study? Since they have asked professional everywhere, 26 is written. So 78476 is a multiple study for the cardiac blood. This is the indented code, so I'll be reading the code about that because I can see the first letter in the small case, so that is a kind of a hint I'm giving you that whenever you see that, that means this is indented code. Then 78451, it is also the code for the myocardial perfusion imaging tomographic, uh, including attenuation, correction, quantitative, qualitative, wall motion, ejection fraction by the first pass, and gated technique, additional quantification when performed single study. And 452 is the multiple study. And 78453 is the myocardial perfusion imaging planner, including quantitative, qualitative, wall motion, ejection fraction by first pass or gated technique, additional quantitative single study. So this is the SPECT scan because it is a tomographic, while in our patient case, nothing like that has mentioned. So in between, you have to be very specific in reading all the codes, and then we decide the answer. So yes, 78453 is the correct answer because it talks about the myocardial perfusion imaging and it is a single study. The other one was a SPECT tomographic. So in between these two, this is the more appropriate language and we'll go with this. So this is here we end the radiology. I will share the question bank of radiology in the next week, and I'll be starting modifier, most probably modifier chapter next.